to Why I Vaccinate. Our next guest is Ruthanne Sudderth. She's a parent and the Senior Vice President with the Michigan Health and Hospital Association. It is really nice to have you on the show, Ruthanne. Welcome.
Thank you. Thanks for having me today.
Talk a little bit about what the Michigan Health and Hospital Association has been doing to keep families healthy, both before the pandemic and now during the pandemic, Ruthanne.
Well, the MHA represents hospitals and health systems across our state, and our mission is to advance the health of individuals and communities. And so both before the pandemic and during and hopefully after, we've been very focused on making sure our member hospitals and health systems and the communities they serve really have the tools and information they need to live healthy lives. So we advocate for issues that are really important to improve health access and cost and quality. And we do a lot of education. And in the pandemic, we've been very focused on making sure that hospitals have the tools they need to be there, to be open 24/7 and providing patient care, both to those who have COVID and those who have other health concerns. Earlier, we heard Dr. Benjamin talking about people delaying care, and we're seeing a lot of traffic in hospitals now, related to issues that folks have maybe put on the back burner during the pandemic. And so, we're seeing a lot of things come to a head right now when it comes to the health of our Michigan residents.
Now, what are some of the big priorities that you have for this coming school year as children head back to school pretty soon here?
Yeah, I'm seeing some of my friends already heading, their kids heading back to the classroom this week, and mine go back in a few weeks, hopefully. And our number one concern is making sure our kids are protected from preventable illness. And we know that there are ways that we can prevent things like measles and whooping cough and all those really important things through vaccination. And so we are making a big effort this August, which is National Childhood Immunization Awareness Month, to really push childhood vaccination. We are, running behind when it comes to our rates of childhood vaccines in Michigan. Thousands of fewer children got their routine vaccines in the last year, and that is putting them at risk and those around them at risk. So we are really urging parents to put this on your back to school checklist, along with getting a backpack and new sneakers and getting a sports physical. Get your kids the vaccines that they need and talk to your physician or your local health department about getting those shots when they go back to school.
And Veronica, I know this is something that you are really passionate about. I mean, we can't really say it enough to parents.
It's so true. I think, we have appropriately been focused on COVID-19, but we can't forget about the importance of these other vaccines and preventing illness. I know, Ruthanne, you are a mom. What are you thinking about for your kids as they're getting ready to go back to school?
I have 7-year-old twins, and we just had a conversation with their pediatrician this summer about making sure that they are up to date on all of their shots. That was a really, really important thing for us to do before they head back to the classroom this fall, hopefully. I vaccinate because it is one thing that I can do to protect my kids in a world where there are so many things that I can't protect them from. But we know that herd immunity and vaccinations are safe and effective, and they protect those kids from illnesses that we don't see very often, but if we let them creep back in, they can cause a real threat to our kids. So we absolutely get our kids vaccinated and make sure that happens before they go back to school.
For COVID, is your family still doing COVID mitigation measures? Are your kids still wearing masks and washing their hands more frequently?
They are. My kids have been out of school since March of 2020 and doing virtual school. And we have a new baby niece in our family. And so we have been very cautious about keeping our kids in pods or in quarantine when necessary. They wear masks when we're around others. And we're very vigilant about the hand washing. And I'm really hopeful that we get the COVID vaccines approved for kids younger than 12 soon so that they can be protected as well. But this is not over. The Delta variant is absolutely taking a toll on kids. We are seeing increased pediatric hospitalizations across the state right now. And that's scary as a parent. So we're doing everything we can to keep them safe. And the best thing I can do as a parent for COVID is to be vaccinated myself, which I am, and that helps my kids stay healthy.
You talk to a lot of nurses around the state, and I'm curious as to what they're saying about their conversations about the vaccine for adolescents.
You know, the healthcare providers that we're talking to across the state, whether it's nurses or physicians or nurse practitioners, are all very anxious to make sure that this vaccine gets to kids as soon as possible. There are millions and millions of children across the country right now that are at risk because they can't be vaccinated. The studies that they are doing on the COVID vaccines are looking very, very promising, very safe and effective, just like in the adult populations. And so I think we'll see strong recommendations from our clinical professionals as that approval comes around, hopefully in the coming months, that we'll be able to get our kids under 12 vaccinated soon.
That's really fantastic.
It is. It's great news. And the funny thing too, and both of you I think would agree with this, is kids are resilient. If you tell them they have to wear a mask and they have to get vaccines and you kind of take the lead and show them how it is, it's not the end of the world for them. They will follow your lead. We have to be leading them.
Absolutely. And, my kids have become mask police for us. They, if they see us going out now, especially back, in Ingham County, we have high transmission again. And so they're saying, Mom, where's your mask? Dad, where's your mask? And they're really good about it. It's not an inconvenience or a bother to them. They know that it's helping to keep them safe and keep their friends and neighbors safe. So we do have to set that really good example for our kids, and they'll follow.
And the other thing that I don't think that we can say enough is the vaccine for COVID keeps you out of the hospital. Some people, there are some breakthrough cases. They may get slightly ill, but for the most part, they are not being hospitalized if they've been vaccinated.
That is absolutely true. Across the country, more than 95% of the people that are vaccinated are not ending up ill or hospitalized. That's, tens and tens of millions, hundreds of millions of people. And the same statistic applies here in Michigan. More than 99% of the people that are vaccinated are not going to die from COVID. Those are very effective numbers for a vaccine. And we know that it's safe. So very simply put, this is the way out of this pandemic, to get vaccinated as quickly as possible.
And Ruthanne, how are your hospital workers doing? I mean, they have been under tremendous stress. They've worked harder than ever during this pandemic. How are they doing right now?
It's been a long 18 months for our healthcare workers. And that doesn't just include our doctors and nurses who have just been doing tremendous work, but our environmental service workers and transport individuals who are working around the clock in our hospitals. They're, having a hard time, and they're burned out, and it's been a tough emotional and mental toll. They've had to watch their coworkers and their family and friends get sick and hold their hands while their family couldn't be with them. That's a lot to take in. And so one of our big focuses this year at the MHA and with our members going forward is going to be helping our healthcare workers recover. But the public can help too. And that's by not ending up in the hospital with COVID. The faster we can do that, the faster our healthcare workers that have put everything on the line for our public, they can recover too.
Ruthanne Sudderth, parent and senior vice president at the Michigan Health and Hospital Association. Thank you so much for your time today and for the great advice.
Thank you for having me.
You are listening to Why I Vaccinate. Coming up next, we are going to talk to a teacher who is on the front lines. She's getting ready to go back to school. We'll be back right after.